Well, hello, I am Sharon Floe, and I'm Made for More.
Welcome back to the Made for More podcast, presented by Adventist Health and Rideout. It's a podcast dedicated to sharing inspiring stories from the community we are proud to serve. In today's episode, longtime community member Sharon Floe shares her inspiring story about a serious heart condition and the impactful care that she received at Adventist Health and Rideout. We're also joined by Dr. Andrew Bellino, Medical Director at Adventist Health and Rideout. Dr. Bellino shares insight into the progression of care that Sharon received during her time at Adventist Health and Rideout. All right. Well, Sharon, Dr. Bellino, thank you guys so much for being here. Hope you're doing well this morning. Kind of how I wanted to start this discussion. I wanted to both give you a chance to kind of introduce yourselves, tell us a little bit about who you are and what you do. Sharon, I'll start with you. Can you just tell us a little bit about yourself?
Well, Sharon Floe, and I moved up here with my parents when I was in 1979 when I was 14 from the Bay Area. We had moved up here. My dad was the pastor of a church, and then I married my husband, who was in the Air Force, and we went to Okinawa for 3 years, and we've been married 39 years, and it's just been a pleasure to be here today.
Yeah, thank you so much for being here. We really appreciate it.
Thank you.
Of course. Dr. Bellino?
Yeah, I'm Andy Bellino. I'm originally from the Midwest, actually moved out to California about 8 years ago. I've been in the Marysville, Yuba City region for about 4 years, and then at Rideout for about the same time, 4 years. So I'm an emergency physician and then also the medical director of our emergency department.
Awesome. Fantastic. Well, again, thank you guys. We really appreciate it. I'm looking forward to the discussion we're going to have today. And Sharon, it really starts with you and your experience at the hospital and kind of what brought you in. So I kind of wanted to start there. Can you take us through kind of what brought you to Rideout?
In the latter part of December last year, I had developed a tooth infection, and I went and saw my doctor, and he gave me antibiotic shot and antibiotics and told me to go see my dentist. And so I went and saw my dentist, and he confirmed that I needed a root canal. And so I finished the antibiotics, and I ended up having to go through another round of antibiotics because it came back with a vengeance. And it was the weekend, and I had to go to urgent care. They gave me antibiotics again, and I finished that round. And me and my husband had planned a trip to Georgia to go see some friends of ours. He came into the Air Force with my husband, and she was a close friend that had been in our church. And so we decided we wanted to go visit them.
Yeah.
And was there for 5 days and came back, and I thought everything was fine. The antibiotics, I had no problems, but I came back, and 4 days later, my husband couldn't wake me up. I was unresponsive. And so he called my sister, who is an RN. She said, call 911. And so they did. My husband's first reaction was that I possibly had a stroke, which it wasn't a stroke.
Sure.
It was the infection had gotten into my bloodstream, and I became septic. And that's what took me into the ER at the first to Rideout.
Yeah. And as you alluded to there, this story goes beyond a stroke. It didn't end up being a stroke, but with May being Stroke Awareness Month, I did want to ask Dr. Bellino, I mean, when people are seeing signs of something that could possibly be a stroke, like John saw with Sharon, how important is it to get them into the hospital as soon as possible?
Yeah, so time is really of the essence with a lot of medical care, but especially stroke care. There's a saying that goes around that's time is brain. And so we know for every minute that goes by, if it is a stroke, the more damage that happens to the brain, the worse outcomes you're going to have. So we always tell people, if you're at all concerned it's a stroke, you need to get to the hospital and most times call 911 because we want you there as soon as possible. Yeah, absolutely. And of course, thankfully it wasn't a stroke, but you coming in led you guys to find, what else was going wrong. Right. And kind of that's where I wanted to maybe transition to from there. It was determined at some point that, like you said, it wasn't a stroke. It was an issue with the infection in your blood that was impacting your heart.
Yes.
When you find out that kind of information, I mean, what's going through your mind? What's that experience like? Can you take me through that a little bit?
Well, when my husband called 911,
Yeah.
I did come to for a short period of time, and I saw the paramedics, EMTs, but I did not realize what was happening and why they were there. I didn't know that I was still actually at home, and I went back out. And so I didn't remember anything beyond that first day while I was in the emergency room.
Yeah.
And it was when I came to in the ER, they were trying to figure out exactly what it was. They couldn't at first determine, and they decided, it wasn't a stroke. It was that I had the infection had gotten into my blood, which led them to do a angiogram. And that's when they found that I have a very narrow aorta valve. And it was too narrow that they could not go and repair it at that time. And it looks possibly they'll have to do open heart surgery and fix it, or replace it, or fix it, depending on what is the case.
Yeah. Sharon, after it was, determined what was going on, from the conversation that I had with you and John before this, and from the letter that you actually sent in about this experience, it was really determined that they wanted to stabilize three main things. They wanted to make sure to get your temperature down. I think you had like 105.
104, 105.
Yeah.
Yes. I went into ER.
Yeah, absolutely. They had obviously wanted to stabilize your blood pressure levels and then get your oxygen levels up. And seems like three very essential things. And I wanted to turn it to Dr. Bellino here, just asking generally, when someone comes in with that kind of significant cardiac issue, does that fall in line? Is that kind of some of the main goals in terms of stabilizing a patient and getting them to a place where they can start to move forward?
Yeah, we use a lot of different things when we're looking at a patient to know what's the priority and what needs to come first. But what you're describing, blood pressure, temperature, heart rate, oxygen, those are vital signs. And we always say vital signs are vital. So that's pretty much always the first thing. We want to normalize vital signs. And then after that comes all the different tests and things that we can do that we'll look at next. But vital signs are the first step always.
Yeah, absolutely.
Yeah.
So you spent some time in the ICU.
Yes.
Yeah. Which can't have been probably not that fun of a time for you. But got stabilized. I think ended up going up to the 4th floor on account of,
cardiac floor.
Cardiac floor, which with everything that was going on with your heart. From there, I think transferred to 3 West to kind of continue the recovery process.
Well, so when they moved me to cardiac, that's when they did the angiogram.
Yeah.
And finally, I was stable enough to where they put me down in 3 West, which is where my sister worked.
Yeah.
So it was nice to be on that floor because I felt comfortable. No, they knew my sister and all that.
Yeah.
And so but I recovered, like I was on the ventilator in ICU. They took that out within 2 days.
Yeah.
And the oxygen began to come up. And so they were very surprised at how fast that I was recovering. But I take it and at the point I did not realize to the extent of all that was going on. My husband had told me that I crashed 2 times.
Oh, wow.
And when I was in ICU, I believe it was, or emergency. And so I began to, on the 4th floor, recover better and went down to the 3rd floor.
Yeah.
And they were still trying to keep my oxygen and up and all of that. And so I was there in the 3rd floor for 6 days. So it was very, I was kind of nervous.
Yeah. Yeah.
But I knew I was in good hands. I knew that the God that I serve worked miracles.
Yeah.
And when I look back, it was a total miraculous healing.
Yeah.
And I just want to give all the credit to Rideout for their support and their caring. And it just made the stay a whole lot easier. And there's a song, "To God Be the Glory" by Andre Crouch that has led me and kept me to know that he is still in control. And he used the doctors to know, because at first really didn't know what was going on.
Yeah.
But it helped them to figure out and know exactly what was happening.
Right. And you mentioned there was a point where, after talking to your husband, you started to, realize the gravity of the situation.
Yes.
When he told you that you had crashed twice. And I'm sure that had to be a really, like you said, there had to be a lot of nerves and anxiety and, frankly, feelings of fear kind of associated with that.
Right.
And I wanted to turn it to you, Dr. Bellino, because in those kinds of situations, especially when we're dealing with something like the heart, I think there is a lot of fear. There is a lot of feelings and emotions kind of swirling around a patient's head. And they look to staff, they look to nurses, to doctors for kind of reassurance. And I wanted to ask you about, how you handle those situations. How do you, obviously be forthcoming and be direct about what's going on, but also, try and be a reassuring and positive voice and perspective in these patients' lives?
Yeah, like you said, it can be difficult, especially because what Sharon's describing is not a very common situation, right? So it's complicated. It's not something people are familiar with, and it's difficult for them to really understand what you're trying to describe. So you want to do your best when you're having those conversations. And like you said, anytime you say the word heart to a patient, they automatically kind of get stressed, right? Because everyone knows that's a very big deal. So I think what you want to try to do is first, take your time with the conversation, let people know that you're listening. You want to use as simple terms as you can. And then what I try to do is really point out the positives, and say, hey, look, the good news is your blood pressure is getting better. Your oxygen levels are coming up. If they're having pain, your pain might be getting better. Again, we can use some lab tests sometimes to say, hey, this enzyme that's related to your heart that was, up here, look, it's coming down to here, and kind of show them some of that progress that way so that they understand what we're looking at when we talk about how things are going.
Right.
And I think also letting them know that we understand the fears, saying, this must be so scary. I'm really sorry, but we're all here for you and we're trying our best to get you better.
Yeah. And I'm really glad you said that. Talking about us all being there for you. And in that letter that you and John wrote, it was so telling to me that you knew pretty much everyone who came into your room to check on you by name. I mean, to me, it showed, A, how much you appreciated that, but B, how much of an impact that these people were having on you during your stay, from each different location you went to. And I kind of wanted to ask you about that. I mean, you had everyone from nurses to Patience Boudreau, our foundation director, coming in, checking on you, praying with you.
Yes.
How impactful was that? What did that mean to you to have, kind of all these people caring for you in that way?
I can't begin to describe, the feeling of love that you are in their care. The very first night, and I believe that's when a miracle happened, our church had gathered, and they had a prayer meet just to pray for me. And at that point, I was out. But after that, I began to recover. And I know it was, there people in the hospital caring and looking to figure out exactly what was happening. Because, I went to bed that night. I didn't know that I felt fine. So it was sometime in, I don't know how long. But it's reassuring to know that you are loved and you are in good care.
Yeah, absolutely.
That was very inspirational to me. I had numerous from people in our church and the hospital, all of them coming in, checking on me, praying with me, and it was just a wonderful feeling.
Yeah, definitely. I mean, you talk about that, like a community of people all coming together to support you, to care for you.
Yeah.
And, even within the hospital, there's a large community of folks. And I was going to ask you, Dr. Bellino, I don't think the average person realizes just how many people go into the care of a single patient. I experienced this recently with, in my personal life, just being in the hospital for a night and seeing how many people are coming in and out, checking on a patient, making sure they're okay, seeing what they can do. It's not always just providing direct care. It's, hey, do you need an extra blanket? Can I get you something else to eat? Things like that. It really takes a village. And I wanted to ask you about that a little bit. Just, how important is it to have these kinds of people that are dedicated, that really are invested in caring about their patients. I mean, it seems like it's so crucial to have those kinds of people in all of these different kinds of roles.
Yeah, absolutely. Because I mean, Sharon's doing a great job of explaining, though, there's not only the physical parts of care, but there's a spiritual part, there's a mental health part, there's a community aspect, there are loved ones who are also involved in this. There's so much that goes into it that's not just what we, the doctors or the nurses, might be doing. And so not one single person can take care of all of that. And so you really need a lot of different people helping to support that patient through what they're suffering from. And having a team like you described is the only way to do that type of thing. And I think having a team that really truly cares about that individual patient is how you go from a good care team to an exceptional one, because there's so many things happening all of the time. And it's easy to kind of overlook things and just keep moving throughout your day. But if you truly are caring about the individual at an individual level, that's when you can kind of notice certain things, right? Like maybe a vital sign that's a little bit off, or something that they said earlier that kind of now, makes more sense in the moment. And you catch those small things that can, lead to very severe outcomes if they're left unchecked. And so you have to treat people like you would treat your own loved ones to be able to do that type of thing.
Yeah, absolutely. And I think there was a point in this hospital's history where that wasn't the standard, right? Sharon, you've been here for a number of years in this community. I think you can recall a time where maybe people didn't expect that kind of care at the hospital.
Yes.
And I think, stories like yours are really inspiring, not only because of the care you received, but the fact that, we're moving as a hospital in the right direction, and we're doing it because we want to be able to care for our community and provide the kind of care that people can rely on, people can expect, and people should expect out of their community hospital.
Yes.
Yeah.
My mother, years ago, and you talk about there was a period of time where, and I saw that with my mom, because she had cancer, and it wasn't, this was back in 88.
Sure.
But it wasn't, it's totally different. You feel the love and the care. And that is very vital to a patient, because if they don't feel that, then it's harder on their recovery.
Yeah.
They don't, understand. And when I was in it, I tried to show them, the nurses, as a patient, how thankful you are for what they are doing for you.
Yeah.
And that they are trying their best and understanding what is going on with you. And that's the best care you can get.
Yeah. Yeah. It really speaks to those, intangibles. I mean, you can have great skilled doctors and all that, but they have to care too. There's got to be a level of compassion and care to the care that they're providing. Definitely.
Right.
Sharon, I wanted to kind of take a moment for you to reflect on the experience as a whole. You were discharged in early February, I believe.
Yes.
I'm sure the recovery process has taken some time. But I wanted to ask you about, kind of what this entire experience has been like for you. Not, no one ever wants to be in the hospital for a heart condition, no less, but, it seems like it's been something that's been really impactful for you. And I wanted to ask you about kind of reflecting on it now. How do you feel about the experience?
I feel it was very, at the time, I didn't really realize, but, so I wasn't all that nervous or anxiety. I knew I was in good care. And so it did take a little bit of a process
Yeah.
to fully recover. But I feel that I was blessed in knowing that what I had, the care that I was given was beyond. It does do a whole lot for a patient to know that they are cared for, they're loved. And I know there's maybe sometimes they don't have family that do care about them. But yet the hospital, the nurses, the doctors, when they feel that coming from them, it helps them to recover. And that's what I look back on, is that I was in total, good care.
Yeah, definitely. And then one last time, Dr. Bellino, I wanted to turn it to you. These are the kinds of stories that we're always hoping for coming out of the hospital. People who have had good experiences that were able to, get back to their way of life, to recover well, and have been cared for as much as we possibly can when they're in the hospital. To hear stories like these, because they aren't always success stories, and that's just a hard truth of what we do at the hospital. But to hear stories like these, where every step of the way they received great care, they were able to recover and leave the hospital and go back to it. I mean, what is it like to hear these kinds of stories as a doctor?
Yeah, I mean, it's rewarding, and it reasserts why you went into what you did, right? Because that's what we want to do as doctors, is provide the best care possible. And as you mentioned, sometimes we can't do that because medicine is complicated and unpredictable at times. But when we're able to just hit the nail on the head and do things perfectly, it's just a great feeling, especially as an emergency provider, because, when Sharon leaves us, as she mentioned, she's on a ventilator, she's confused, she doesn't even really remember it. But then to see her here months later, standing in front of us doing well, it's really great to see that type of thing. And again, that's what we're here for. So
yeah, absolutely.
Yeah.
Sharon, I wanted to ask you, what's very openly, very broadly, what's next? You and John have any travel plans in the future? I know both of you are very involved in the community. Wanted to see kind of where the road leads you from here.
Well, we don't have any, plans for this year.
Sure.
And we're just trying to make sure that everything is, okay.
Yeah.
One day it does look possibly, because my aorta valve that I, which can be there's another miracle.
Sure. Yeah.
There, where I won't necessarily have to have open heart surgery, but but possibly next year, we might be going on a cruise with our family. My niece, my sister's daughter, is graduating, and she's going to be an RN.
Oh, wow.
So we're going to celebrate her completion of her, and possibly go on a cruise
That's wonderful.
next year.
Yeah.
But that's kind of where we're at right now.
Yeah.
And waiting, make sure that everything is okay.
Yeah, absolutely. Well, I wanted to thank you both again for being here and having this discussion today. I think stories like these are so inspirational and so important to what we do. Before I'll let you guys go, is there anything else that you wanted to add or touch on, anything like that?
No.
Yeah, I'll just say that I thank Sharon so much for coming and telling her story. Again, it's really helpful for us as providers to hear stories like this and to know that people are appreciative of what we're doing, and that we are, again, able to heal people in the way we want to. So I just thank you for that.
Thank you.
Well, thank you
It's been
guys.
my pleasure.
Yeah. Well, thank you guys again. This has been really special. I'm glad we got to sit down and do this. And thank you guys.
Thanks.
Thank you.
Thanks so much for watching this episode of the Made for More podcast. To listen and find out more, check out our podcast on YouTube, Spotify, or wherever you get your podcasts. You can also find out more about Adventist Health and Rideout at www.adventisthealth.org. Thank you.